Good afternoon. This is Kim Clater with NTA Incorporated. Welcome to our presentation on substance abuse and addiction in the workplace. Today, our training outline will cover quite a few items. We're going to go over a basic overview of a drug-free workplace program, nature of addiction, what that means, try to go over just some basics of that, and the bulk of our material today is drawn from the American Psychiatric Association on addiction, along with some aspects of mental illness as they go hand in hand with addiction, identifying performance problems and handling potential crisis situations as they relate to addiction and substance abuse in the workplace. Again, recognizing problems, intervention and referral in the workplace, how to protect confidentiality, some of the rules and regulations in regards to that, continued supervision if your company is a company that does allow employees to come back, subsequent to identification of an addiction program and help. Some pitfalls of recognizing enabling behaviors, basic do's and don'ts for employers and supervisors. Let's go ahead and get started this afternoon. So understanding the nature of addiction, in the course of the bulk of our training, as we go out and we train, we speak with clients and trying to equip them and supervisors to understand how to recognize substance abuse in the workplace. One thing that we have noticed is often there is a basic misunderstanding on the nature of addiction. And often what we run into, there is a common misconception that the individual that has an addiction is an individual that should be able to just stop using the drug, whether that's cocaine, whether it's methamphetamines, whether it's opiates, that they simply should be able to stop using that drug. And this would even include alcohol, this would include marijuana. That is really not the case. What has been learned over the last, I guess, probably 10 years particularly, is that there are some major physiological and psychological changes that take place within the body that does prevent the individual from being able to stop using the substance, whatever that may be. So let's explore, what is addiction, what it does to the brain, what it does to the body, what does this mean? To try to help you as the employer understand what you are dealing with. It is a very serious disease. I don't want to come across as warm and fuzzy about this. I mean, often the user did start out, they made a choice to use, but what the employer does need to understand and what individuals need to understand is once those neurological pathways and that rewiring of the brain takes place, that individual is not going to be able to stop using that drug, using that substance, until they receive professional help. So let's go ahead and let's learn about the nature of addiction this afternoon. So the actual professional medical definition of addiction is the irresistible compulsion to use alcohol or other drugs despite adverse consequences. And this can include behaviors. I'm not going to spend a lot of time this afternoon on things such as gambling. There are other types of behaviors that can be addictive, gaming, gambling, that kind of thing. We're just going to limit this to the use of alcohol and drugs. But it is an irresistible compulsion to use alcohol and other drugs despite adverse consequences. It is characterized by repeated failures to control use, increased tolerance, and increased disruption in the life of the individual and his or her family and work, and their workplace and their career. That is the medical definition. People with a substance use disorder have distorted thinking, behavior, and body functions. Changes in the brain's wiring are what cause people to have intense cravings for the drug and make it hard to stop using the drug. Brain imaging studies show changes in the areas of the brain that relate to judgment, decision making, learning, memory, and behavior control. So what they are saying, and of course this presentation this afternoon isn't designed to get into drill down into some really deep nuts and bolts. Those presentations can be hours upon hours. But what they have learned when they take a brain imaging of a person that was pre-addiction, so this would be someone that is not, say, an alcohol addict or someone that is not a cocaine addict, the pathways, the neural pathways in the brain are very, very different. And if a person has a cocaine, for instance, a cocaine addiction, or they have an opiate addiction, those pathways change. When they do studies with research animals, if they've done these with mice or with rats, and before they would feed the research animals the drug, they do the imaging, and before and after, and they can see that those pathways change. So they completely, what these drugs do, they completely rewire the brain. So what does that do? That changes the ability of the individual to control the craving for these drugs. It also affects bodily functions. It can affect the cardiovascular system. It can have an impact on the pulmonary system. In other words, the ability to breathe. So, in other words, for instance, the opiates, the painkillers, the narcotics such as OxyContin, Lortab, hydrocodone, the painkillers like that, codeine, morphine, those can affect the body's ability to automatically, the brain's ability to automatically tell the user to breathe. So it can affect that. So it can also affect those parts of the brain, whereas a person would have perhaps originally, they were born with perhaps normal or perhaps even above normal ability to have good judgment, make good judgments. Perhaps they would have, excessively good physical attributes in terms of motor control, athleticism. They could be very smart. They could have very good memory retention. The drugs change all of that. They affect those pathways. They can damage those pathways. So it would change a lot of things about that individual. So, the users, the drug user, when they set out to use the drug, there's a lot of different reasons, which we'll explore momentarily. But most drug abusers, whether it's alcohol, cocaine, methamphetamines, whether it's opiates, the heroin, whatever it might be, they do not realize, most of them are looking for that pleasure. They're looking for that sensation, that relief that they get from the drug. They're looking for that coping mechanism. Excuse me, they're not even thinking about the fact that their entire brain is being rewired and that they're going to have these changes within their body. So this is an important, very critical thing to understand about addiction. This is why it is so hard for that individual to just put the drug down, put the drink down, and just stop. So let's go ahead and move forward on this. These substances can cause harmful changes on how the brain functions. It can last long after the immediate effects of the drug, which is actually called the intoxication. Now, the intoxication is typically what the individual is looking for. This is where they have the intense pleasure. It can give them a sense of calm. It can give them a sense of euphoria. This is where the increased sense or a high, that's what's caused by the drug. So that's the technical term for intoxication. So the harmful changes last long after the immediate effect of the drug, which is the intoxication. So over time, People with addiction build up a tolerance. This means they need the larger amount, they need more and more of the drug to get this intoxication. So to get that sense of pleasure, to get that sense of calm, to get that sense of peace or euphoria, they're going to have to take more and more of that drug. So for instance, with your stimulants, which is normally your methamphetamine, your amphetamine, your cocaine, for example, those drugs create a very intense sense of pleasure, a very intense sense of energy, of confidence, of, I've got the world by the tail type situation. To get that particular feeling, they have to take more and more of that drug. So again, that is another very dangerous aspect of addiction, because those drugs also speed up. Remember, it affects the body functions. Those drugs speed up the heart rate. They increase the they affect the part of the brain that controls your body temperature. So it can increase your body temperature. It makes it very dangerous. You can have fevers. You can get up to 104, 105, which can then cause seizures and strokes. So again, a lot of connect the dots here. You get into the opiates, which are the ones that tend to calm people down. They tend to give them that sense of peace, that sense of euphoria. Well, again, they're going to build up a tolerance. It means they need more and more to get that sense of intoxication, to get that sense of calm, to get that sense of peace. Heroin's one of those drugs as well. Those drugs all suppress the respiratory system. So to do that, by suppressing the respiratory system, what's going to happen with that? It's going to impact their ability to breathe. So that's what causes the overdose. That's what can cause death. They literally stop breathing. So again, it all connects with this. So it's very, very dangerous. Some ongoing performance problems that do not respond to normal supervisory actions. So in other words, remember, one of the hallmarks of addiction is that they don't care about adverse action, okay? The drug becomes the ruling factor in their life. That drug, getting that drug is the most important thing to the individual. They have to have the drug, like most people have to have water, food, and air. Because if they don't have the drug, they're going to become sick. Their body now needs the drug. The brain has been rewired. The bodily functions have been retrained. So if they have performance problems such as poor attendance, tardiness, unexplained absences, long lunches, you have customer complaints. They're not delivering on time. They're not providing the service that they used to provide. Coworkers are complaining. Mistakes, common mistakes, missed deadlines, that type of thing. Those are all performance indicators that if they do not respond to normal supervisory actions, it can be a sign of addiction. And it may require more intervention. It may be something that as a supervisor, you are going to want to step back, take a look, and go, is there something else going on here? Because again, adverse consequences typically, they will not be something that an addict is going to respond to. Other things that you may see in a person that is an addict, you're going to see an abrupt change in behavior, loss of interest in previous activities. So if this is a person that was perhaps, very active in, say, their church, they were very active in sports, a particular activity, maybe arts, whatever it may be, they're going to lose interest in that for several reasons. Number one, the drug is going to take over. That's their primary goal, is to get the drug, to get, to function. Plus, it's going to, if they're involved in some of the more severe drugs, such as cocaine, methamphetamine, heroin, it's going to take most of their resources. Those are expensive drugs to try to get and to acquire, and to also they have to use a lot of them to support those cravings and to keep that up. If you see a lot of secretiveness and they avoid straight friends, they avoid people in authority, a lot of moodiness, shortened attention spans, if they develop I couldn't care less attitude, inappropriate overreaction to criticisms, if you see in the workplace an increase of reported theft of jewelry, money, tools, any items that are easy to sell or pawn, you have to understand that the addict is going to lose their moral compass. Again, the addiction, the need to get the drug, is going to surpass anything. They have to have the drug. They're going to become sick mentally and physically and psychologically. They have to have the drug. So they will steal from their employer. They will steal from their coworkers. They will run through their family's resources. So you want to really take notice if you have reports of theft of jewelry, money, tools from coworkers within your workplace, anything that is easy to sell or pawn. That could be a sign that you have some substance abuse or some addictions going on within your workplace. Careless risk-taking, needless mistakes. Total disregard for personal appearance, company property. So if you have someone that perhaps was very, a very tidy, very well-kept individual before, perhaps they were very conscientious about their workplace, their workspace, their equipment. Now they're very disheveled. They don't take very much pride in their personal appearance, or if they have a company truck or company equipment, or if they have an office and it's a mess, dirty cups and things lying all around. If this is something that is different about this individual, those are just small things, but they can all add up. If they tend to lie about whereabouts activities, a lot of unknown people and visitors in the workplace, and unexplained disappearances from the job site or the workplace. So a lot of people coming in and out of the workplace, unexplained disappearances from the job site. All of those can add up to they need the drug in the middle of the day, they can't get through the workday without it, and they have someone bring it or they will go get it. These are all things to keep in mind. According to the National Institute on Drug Abuse, which is NIDA, commonly known as NIDA, people began taking drugs for a variety of reasons, which include 1, to feel good, the feeling of the pleasure or the high, to feel better as a coping mechanism. In other words, to relieve stress. So in other words, rather than going out and, trying to do something such as exercising or, hiking or finding a sport, doing something constructive such as that, they simply will reach for the drink, reach for the drug. To do better, they will take this to improve their performance. So in other words, some of the drugs will give them more energy. They will give them, more strength, more confidence. The problem is that is very, very short term, very short-lived. To their detriment, they will end up addicted to a drug that has many, many more mental and physical problems attached to it than that short-term performance improvement that they had. And simply, some people are just curious. They're just curious, and then they succumb to peer pressure. So, what we do see most often are usually the top two. They're seeking pleasure, they're seeking a high, and to relieve stress. They're just seeking a little escape and their coping skills. People with addictive disorders may be aware of their problem, but they become unable to stop even if they want to. The addiction may cause health problems as well as problems at work and with family members and friends. The misuse of drugs and alcohol is the leading cause of preventable illnesses and premature death. Severe alcoholics will shorten their lifespan by roughly about 10 years. So that's something to keep in mind as well. Symptoms of substance use disorder are grouped into 4 basic categories. You have impaired control, that is a craving or strong urge to use the substance, desire or failed attempts to cut down or control substance use. You have social problems. Substance use causes failure to complete major tasks at work, school, or home. Social work or leisure activities are given up or cut back because of substance use. You have risky use. Substance is used in risky settings, continued use despite known problems. So again, you're going back to there is this complete disregard for adverse consequences. Drug effects, tolerance, the need, you develop the tolerance, need for larger amounts to get the same effect. Withdrawal symptoms are different for each substance. The withdrawal symptoms that you can see can be very similar to some of the effects of the drugs. An individual that starts going through the withdrawal symptoms, you can see sweating, you can see clammy, kind of a clammy, pale, bluish tint to the skin, sweating, they look like they're going to pass out, they can become nauseous, they can start throwing up, they become quite sick. This is, again, why they're going to go and try to get this drug as quickly as they can to relieve the withdrawal symptoms, because some of the drugs, particularly heroin, methamphetamine, cocaine, these withdrawal symptoms are very severe, very quickly. Many people experience both mental illness and addiction. The mental illness may be present before the addiction, or the addiction may trigger or make a mental disorder worse, which really is quite concerning. So someone that perhaps has a genetic predisposition to mental illness could, potentially be fine, may never, really have a problem with that. But if they were to start drinking, maybe start playing around with drugs, they could trigger that mental disorder. So they do go hand in hand. There are often, dual issues with this, and when they go into treatment, they normally explore both avenues. People can develop an addiction to alcohol, marijuana. Contrary to popular opinion, marijuana is addictive. So particularly the marijuana that is now pretty much in the marketplace has a very high level of THC. So it is not the marijuana of yesteryears. We have pretty much a very high level of THC, so it can be addictive. You have PCP, LSD, all of the hallucinogens. You have inhalants, such as paint thinners, glue. You have the opioid painkillers, such as codeine, oxycodone, heroin. You have morphine. You have fentanyl, which is a real problem right now. Fentanyl is coming into the country at a very rapid pace. It has been pouring in over the last few years, a very dangerous, very, very potent painkiller opioid. It is out there. You have sedatives, hypnotics, anxiolytics. These are medicines for anxiety, such as tranquilizers. People do abuse those, and they do develop addictions to them. And then, of course, you have the stimulants. You have cocaine, methamphetamine, and of course, you have tobacco, which is nicotine. So, that is one of the lower level ones, but you can develop an addiction, and of course, that can be kind of tough to beat too. So, treatment, and there can be different levels of this, and it depends on each drug. Some of the treatments can be outpatient. So you have effective treatments, pretty much for, the different levels of addiction and the different drugs. But for all of them, you have effective treatments. The first step is to recognize the problem. The recovery process can be hindered when the person denies having a problem and they lack the understanding about substance misuse and addiction. So you've got to understand, this is what we run into all of the time, that you cannot do it alone. You have to have typically an intervention, and you have to have that recognition that I have a problem and I have to have professional help. I cannot do this on my own. So the intervention of concerned friends and family, sometimes the employer is what prompts this. It often prompts treatment. A health professional can conduct a formal assessment. Sometimes this is the EAP provider. In the DOT world, this is often the substance abuse professional. They assess the symptoms. They try to determine if a substance use disorder exists. If it does exist, they will determine would they benefit from treatment, and if so, what degree of treatment. So let's take a look at the different types. Because addiction affects many aspects of a person's life, multiple types of treatment are often required. For most, a combination of medication and individual or group therapy is most effective. Treatment approaches that address an individual's situation and any co-occurring medical, psychiatric, and social problems can lead to a sustained recovery. Okay, that is super important. We want a sustained recovery. Medications are used to control the cravings and relieve the severe symptoms of withdrawal. This is why it is so important to understand they cannot do it on their own. They need to have that professional oversight and the prescription medication to control the cravings and relieve the withdrawal symptoms. Therapy can help addicted individuals understand the behavior and motivations, what led to this to begin with. Develop higher self-esteem. That generally takes a pretty high hit. You know, people don't like to realize, hey, look what I've done. So it can help them develop higher self-esteem, cope with stress. Now that my coping mechanism of the drug or the alcohol has been taken away, how am I going to cope with stress now? You know, it's going to teach them healthy ways to cope with stress, how to address any other health problems. Treatment may include hospitalization, therapeutic communities, highly controlled, drug-free environments, or sober houses, and of course, outpatient programs, which are normally, that's the most commonly used. The hospitalization, therapeutic communities are the least often used, except for usually the most severe cases, because they're also usually the most expensive as well. So this is normally, most treatment is provided by outpatient programs. Preventing relapse to substance abuse is mainly a matter of becoming aware of the triggers and finding ways to avoid or cope with them. This is super important. This is addressed normally at great length in the treatment program and by the therapist. The triggers can be external, for example, being in places where the substances are used. Where did they use them? Stress, job stress, financial stress, arguments with important people in their life can also be external triggers. Triggers can be internal, such as the drug cravings, depression, anxiety, hunger, fatigue. The key is to anticipate and understand triggers so they don't come as a surprise, and use a plan or coping strategy to deal with the triggers. Usually professional help is needed to gain awareness and develop the plan to deal with it. There are also very good medications for alcohol, opioid, and tobacco use disorders that reduce cravings and help prevent relapse. Sadly, the statistics do show that you have to understand that addiction is a chronic disease. Most people are going to relapse. That should not be cause for despair. They need to understand that, try to understand their triggers. If they do relapse, quickly seek help, get back up on the proper path, get back up, on your program, and, get back on the right path, and, hopefully the relapse will be very short. But, unfortunately, it does occur, several times over the course of their lifetime, because it is a chronic disease and those cravings are, and the addiction is so strong, those patterns are so strong. Remember, the brain was rewired, the bodily functions were rewired. Individuals that have a great deal of drug or alcohol addiction among family members are at high risk. I'm not going to read, all of this. This gives you some of the data. Roughly, you have about a 50% higher chance if you have this in your family. It increases your risk, a genetic predisposition of about 50%. But the good news is half the risk is for developing it is environmental. So effective interventions can probably prevent it in many genetically susceptible individuals. So one of the keys for most people is to understand that if there are drug or alcohol addictions in family members, that there could be genetic predispositions, but also understanding that that is not, a reason to automatically just assume, hey, this is going to happen. You have a 50% chance of also realizing, hey, I may never have a problem. Education, knowledge is power, and in this case, this is definitely, one case that you can apply, that definite power here. This is an interesting chart. This is aimed at really, children and adolescents, but it's good to kind of to think about this individual where this could start, and particularly if you have young, the younger employees in your workforce and your workplace, but it can kind of go on up the ladder in terms of age. But some of the things they look at risk factors that would have started down the road of addiction and using drugs: aggressive behavior in childhood, poor social skills. Did they have availability of drugs? Lack of parental supervision. Did they experiment with drugs? Did they grow up in a community, that was quite poor? Some of the protective factors that perhaps could have kept that individual, out of drugs. These are things to think about that can be protective factors. Good self-control, developing positive relationships. Now, again, this is, aimed towards children, so I won't go into too much of that. Did they have good parental support? Were they academically competent? And then, of course, did they grow up in, a good environment? So you can apply some of this, go back and look at these individuals, and also kind of apply this to the mature adult as well, just taking it into the workplace environment. So it's kind of a little bit of an eye-opening chart there. So now that you understand the basics of addiction, let's take a look at how that would apply to a good drug-free workplace program. Now, a drug-free workplace program is going to deal in the workplace with identifying those that perhaps would have addictions, and then, what do you do with that? How do you identify them, and what do you do with that? And that doesn't mean just drug testing. You have to do several things. And most states do have guidelines, and they have statutes, and they have laws that govern that. And most of your basic components would involve, number one, a written substance abuse policy. It has to cover, typically it has to cover the types of testing. Are you going to be doing pre-employment, random, post-accident, reasonable cause? Will you be offering treatment for positives, or will you simply terminate? If you do offer treatment, is it through an EAP program? When they come back, what type of follow-up testing would be involved? You have to think about those kinds of things. You would want to provide some type of substance abuse education and awareness for your employees, whether you terminate or not. And that would involve, just you can get posters. You can go to the SAMHSA website, the NIDA website. There's a ton of free posters you can download. We have booklets at NTA We can send you basic education on substance abuse for employees. Reasonable suspicion training for supervisors. This is an in-depth training. We offer this. We have several different options on that. This teaches supervisors. What do you look for on each individual drug? How do you approach the employee? What must you legally document? What can you say? What do you not say? You have to provide those types of things. So these are your basic components in fighting addiction in the workplace, is having a sound drug-free workplace. What are your responsibilities as an employer in essence? Maintain a safe, secure, productive environment for your employees. Evaluate and discuss performance with your employees. Treat them all the same. You can't pick and choose who you keep. So in other words, I want to keep this employee even though I think they may have a problem, and I don't want to keep this employee who I'm sure is using drugs. It has to all apply the same. You must act in a manner and approach your employees in a manner that does not demean or label people. That should go without saying, but over the years we have seen some really bizarre things. It is not your responsibility as a supervisor or an employer to diagnose drug and alcohol problems. That is not your responsibility. You leave that to the professionals. It is not your responsibility to have the answers. It is not your responsibility to provide counseling or therapy. And what we mean by that is it's not your responsibility to sit down and try to, if the employee wants to, talk to you or, tell you everything instead of trying to get help, that's not your responsibility. You want to point them towards help. It's not your responsibility to do that. It's not your responsibility to be a police officer. Legally sensitive areas that you want to steer clear of or be aware of, you must safeguard the employee's confidentiality. You must ensure that your policy is clearly communicated. You must establish procedures to thoroughly investigate these alleged violations. You must provide due process and ample opportunity to respond to the allegations. You must ensure that you have a quality testing program that has confirmation of all positive tests that gives the employee an opportunity to discuss this with a medical review officer. So in other words, you have to understand that people that have addictions particularly are very adept at coming up with wild stories. So if you decide to drug test in your workplace or you drug test, an addict is going to deny. And if you happen to do random testing or post-accident or reasonable cause, and the test is positive and it goes to the medical review officer, they're probably going to deny this and say, somebody put something in my drink or your test is wrong. Medical review officers are trained in interpreting drug test results, and they are certainly well trained in talking to these donors and making it clear to them, no, this test has been confirmed. They go through SAMHSA-approved laboratories. They go through AMIT screening, GCMS confirmation screening. Very good. They're vetted quite well, and the MRO does do that. So once you have a test that has been verified by a medical review officer, that is submissible in a court of law. You're on very firm ground. So you want to make sure you also conform to union contracts if applicable. You want to make sure that you handle potential crisis situations well versus identifying a simple performance problem. So how do you distinguish between the two? A crisis situation is less common than a performance problem, and it consists of dangerous behavior. So addicts can get desperate when they don't have the drug. If, let's say, for instance, they're out of money, they can see that they're not going to get their drug. Their danger can become threatening. It can become very dangerous. Their behavior can become very dangerous. They can show signs of obvious impairment or withdrawal. You may find, or you can find possession of alcohol or other drugs. That can be something that would be a crisis situation. You actually find that in the workplace. Or there's evidence of illegal activity. You learn of that outside the workplace. How is your policy written to deal with that? Or perhaps you find drugs, on the workplace. How are you going to deal with that? Do you do searches, of lockers, on the job site, that kind of thing? So you want to keep all of this in mind. What is the difference between a crisis situation and a simple performance problem? So questions to consider when investigating a potential drug or alcohol crisis situation. What exactly do you see? Do the supervisors that are observing this, have they received the proper training? Does there appear to be illegal activity, policy violations? In other words, if you have the search violations or you've stated in your policy no illegal drugs on the premises, is there any unusual behavior taking place? Is a group of people involved, or is it a single employee? So in other words, do you have a whole department or a crew? Often, if you have a close-knit crew, a close-knit department that works together, they may work closely together, they may party closely together, so you want to think about that. Do you have reliable witnesses available? Or is there any physical danger involved in taking action or not taking action? That's a very important piece of information to consider. Is the situation serious enough to require calling security or law enforcement? Is there a specific policy in your handbook or substance abuse policy that applies to this? Do you need expert consultation from HR, your EAP program, or security, or perhaps your legal department? You want to keep that in mind. Is it a situation that calls for reasonable suspicion testing, and have you documented what you see and what you have done in response? So that's all very important. So recommended actions to take: if you're confronted with a possible drug or alcohol situation, ask the employee to come to a private area with another supervisor and or security personnel or HR personnel, depending on your company. Inquire about the behavior or report. Inform the employee of your concerns. Get their explanation of what is going on. Allow them an opportunity to explain. So in other words, explain what you have seen, what you have observed. Give them an opportunity. Evaluate what they're telling you, and if you feel that there is definitely a substance abuse problem, you want to notify your superiors, your HR, or if you're equipped to make the decisions, then you want to probably move forward. So at that point, you're going to make a decision. Are you going to refer them to your EAP program, if applicable, or if it's a DOT employee, to an SAP? Would you place them on suspension until a more formal investigation takes place? Arrange for them to be escorted home, or escort them to a collection site for a drug test or an alcohol test? So you have different options. You want to think about this and have a plan in place before you would call the employee in. So intervention and referral. So steps to take when you identify a performance problem. You document the problem, get yourself ready, set the stage, use constructive confrontation, refer for assistance, follow up on progress towards meeting performance goals. So again, this would be if it is a performance problem versus an actual drug problem. And this is just kind of a little bit of a tip there. And again, this just goes into constructive confrontation. Tell them your concerns, state the problem, refer to your documentation of specific events. Don't overgeneralize. Ask for an explanation. And then again, you're going to set a time frame for improvement and specify consequences if problem continues. Now, protecting confidentiality. For the employer action to be effective, you need to understand you cannot make the problems public. Conversation with the EAPs or other referral agents are private and will be protected. They will not share that with you as the employer. So you need to understand that. All information related to performance issues will be maintained in their file, their private file. Information about referral to treatment must be kept separately. Information about treatment for addiction or mental illness is not a matter of public record. It cannot be shared without a signed release from the employee. So that is very important. If the employee chooses to tell coworkers about their private concerns, that's their decision, but it cannot come from the company or a representative of the company. When the employee tells their supervisor something in confidence, the supervisors are obligated to protect that disclosure. If EAP services are available, employees are also assured that they are separate from personnel records and can be accessed only with a signed release from the employee. EAP professionals are bound by a code of ethics to protect the confidentiality of the employees and family members they serve. There are clear limits on when and what information an EAP professional can share and with whom. There are some limits on confidentiality that may require disclosure of child abuse, elder abuse, and serious threats of homicide or suicide, as dictated by state law. Reporting participation in an EAP to the referring supervisor so they can let you know that they are participating or not participating. Reporting the results of assessment and evaluation following a positive drug test. Verifying medical information to authorize the release time or satisfy fitness for duty concerns as specified in the company policy. Revealing medical information to the insurance company in order to qualify for coverage under a benefits plan. So these are things that you would want to be aware of as well. So continued supervision. So after treatment, after they've come back, if your company allows this type of thing, you want to continue feedback about behavior. You want to kind of keep an eye on things, encouragement to follow through with continuing care, support groups. If you're aware of that, they want to discuss this, accurate performance appraisals, fair treatment, time to adjust to doing things differently, respect for their privacy, keep the lines of communication open, corrective action. If old behaviors reappear, remember relapse is probably going to occur. So it's going to be kind of a fine line. Allow them some time to come back, get back into the swing of things, feel respected, have some privacy, but you do need to be very aware and do watch for old behaviors. One thing that we do see that does occur over time with supervisors would be enabling. And this can happen sometimes because supervisors can be old friends. They can be very close. They can be family members sometimes within the organization to an addict. At times they can be addicts themselves. So some examples of enabling would be covering up, rationalizing, withdrawing, or avoiding. They just simply don't want to deal with it. They're very uncomfortable. They just don't want to deal with it. They want to blame, control, or threaten. Again, these are all symptoms. These are all things that would be examples of enabling. You are not dealing with the problem. So these are all pitfalls that as supervisors, as management, you would want to steer clear of. So wrapping up, some do's for employers. Do emphasize to the employee you're only concerned with work performance, conduct. Have documentation when you talk with the employee. Remember that these problems are going to get worse. They cannot stop the drug. They cannot stop it. Do emphasize conversations with the EAP are confidential. Explain that the EAP, if applicable, is voluntary and exists to help. Do call the EAP to discuss how to make the referral. Things that you should not do: don't try to diagnose. Don't moralize. Keep your comments to the job performance and conduct issues only. Don't discuss alcohol and drug use. Don't be misled by sympathy-evoking tactics. Remember, substance Abusers and addicts are very manipulative. They are in denial, and they will try to manipulate you to a great degree. So don't be misled by that. Don't cover up. If you protect people, it enables them to stay the same. Don't make threats that you do not intend to carry out. A roadmap to a safer drug-free workplace: identify and investigate crisis situations, recognize problems that may be related to alcohol and drugs, intervene where you need to, refer the employees, protect their confidentiality, and continue to supervise and support these employees that have been referred, and avoid enabling and common traps. For assistance with your needs and questions about addiction, please feel free to call me. My name is Kim Clater. I'm the Compliance Director at NTA. There is my number, my email. I would certainly be glad to answer any of your questions or concerns, and thank you for attending our presentation this afternoon.